History taking is a critical and important part of both being a doctor and a medical student. However, when you are first starting in medicine, it can seem a bit convoluted, the different things you need to cover, the different maybe subtitles, categories that you're going to cover them in. And so in this video, I'm going to go through those different areas, as there are key critical categories that you do need to cover when you're taking a history. I'm hopefully going to make it more clear for you than it was for me when I first started in medicine. But there are still some things that are very easy to miss and hard to make sure that you cover all of them when you're taking a history. So to make that a bit easier for you, throughout this video in the appropriate sections, I'm going to mention 4 different mnemonics that are quite helpful to make sure you don't miss things, as well as to make sure that you take a complete history. Welcome back to Aussie Med Shoots. If you're new here, my name is Francis, and on my channel I talk about things related to medicine, in medicine, and getting into medicine, as well as a bit of just student life stuff in general. So if that's something that interests you, and apologies if you can hear my dog, he's staying in my room for a while I train him a bit better. If that's something that interests you, then please be sure to subscribe to my channel, hit the little notification bell so that you get reminded when I put a video up, as well as leave a comment if you in particular have some useful mnemonics, or if you come across some in the future that you think will help other people out. Even in first year medicine, you're going to very quickly get this message delivered to you many times over, that history taking is the most important part of the diagnostic process when you're working a patient up and trying to figure out what's wrong with them and what you need to do for them. It's usually followed by an examination, so a physical examination, then some investigations, as well as treatment. If you want to be able to get to that point and know what you're going to treat or know what you're looking for on a physical examination, you first need to take that history. And the physicians, the doctors, your lecturers are going to say this a lot. What's the most important part of a diagnostic workup? You've got to say history taking. So like I mentioned at the very beginning of this video, every history needs to cover certain categories. However, there's a slight difference between when you're taking a history, when you're presenting that history back to a doctor or another health specialist, and when you're writing that history up as a note either in a digital system or handwritten. The first area in any history is going to be a presenting complaint. This is usually how you're going to start taking a history, as well as how you're going to first present the history to a doctor. The presenting complaint is just a 1-sentence line, kind of summarizing the basic issue that a patient came in with or that led to them presenting. Next section is history of presenting complaint, and this is where you take the presentation, symptoms and issues that the patient said that they originally came in for, and you start to get a timeline of what led them to the place they're at now. They're going to mention something like, I had chest pain at whatever o'clock, I started feeling sweaty. A super useful mnemonic, especially for pain, it's particularly made for pain, is Socrates. You're going to hear this one a lot when you're first starting medicine. But what it stands for is site, so you're looking at the place that the pain is. Onset, offset is what I like to use, but O is for onset, so what brought it on or what is making it worse. Did it start around the same time as anything else, certain time of the day, or when you ate something, for instance? The next letter is C for character, so you want to get an idea of the type of pain. Is it a numb pain? Is it a sharp pain, burning pain? The next section is R for radiates. Does that pain go anywhere? So the chest pain, one of the first things that might come to mind is a heart attack, and so you might be worried about the pain radiating down their arm or into their jaw, which would suggest that to you. The next letter is A, so you're thinking of associated features. So were you feeling sweaty at the time as well? Did you feel like you had something coming up your throat? Were you feeling really hot and flushed, your heart racing? What other things were going on at the same time? T is for time or duration, so how long did this last for? Another really good question to chuck in here is, has it happened before? E is for exacerbating factors. I think as well you can ask here what makes it better and worse. So did you find that walking around and exercising made it worse? Did you find that sleeping with more pillows under your back made it better? And the final letter S is for severity. I don't really hear doctors actually ask this one very often when they're talking to patients, but on a scale of 1 to 10, how bad is the pain? Now, once you've gotten an idea of the symptoms that they've been presenting with, sometimes it's difficult to know if you've missed something, like, should I have asked them if they had a headache, for instance, or should I have asked them about their muscles, were they sore? And one good way to make sure that you kind of do a scan throughout everything and just ask generally something about all the possible systems that could be affected is called a systems review. The idea is that you ask about the different body systems and organs like the brain, the skin, the muscles, etc. Now, I used to just go like head to toe and try and think of the different organ systems, but one mnemonic you can use if you want to try and tick things off as you go is Munchie Bars. So Munchie Bars stands for musculoskeletal, so you can ask about things like I mentioned already a bit of muscle pain, or have you had any trauma recently? U is for urinary or genitals. You can ask about symptoms of dysuria or polyuria or polydipsia even, which could be related. N is for neurological. I also like to put psychiatric in here, so you can ask the head symptoms that I was mentioning. Are you feeling any changes in sensation? Are you having issues with your vision? C is pretty obviously cardiac, so with my chest pain history, you want to be asking about things like chest pain, but also if this patient has had any coronary problems before. Are you experiencing your heart racing? H is for hepatic, so you can ask about things that could be related to the liver. So have you been getting any pain around your right upper quadrant? You can ask, have you been noticing some yellowing of your skin or your eyes? That's a very important question that's going to come up later as well. E would be for endocrine. You can ask about, have you been feeling really hot or cold lately? Have you been going to the toilet a lot more lately? B is for blood, so have you been noticing any bruises or excessive bleeding after going to the dentist? A is for alimentary, so you're thinking of anything from the mouth to the anus, thinking of the GI tract. So have you been vomiting? Have you had runny poos, diarrhea? R is for respiratory, so you can ask them, have they been feeling short of breath? Have they been coughing? And finally, we get to S, which is for skin. You can ask about any important skin symptoms that might come to mind. For instance, have you noticed any lesions on your skin, any discolorations? After this, you would usually put your examination, but we're just talking about histories. The next section is past medical history. So depending on the age of your patient and how complicated they are, this could be a very long section, but as well their ability to remember what's important. So we always try to start with open-ended questions. So something along the lines of, do you have any other medical problems? And often they'll go, what do you mean? Or like, I have this XYZ, and they can rattle off a list. Very big difference between people that remember and don't remember things. But there are certain things that are very important not to miss, and there are other things that commonly patients will forget to tell you about because they just don't think of it as a chronic medical problem. They've just had it so long, it just doesn't come to mind, or they think it's under control, so they don't think they need to mention it. So a useful mnemonic here, I like to think of you're chatting to a patient, they're being incredibly boring, no offense to any boring patients out there, but you're at the end of your past medical history and you're about to just move on to the next section. You go, hey, actually, have you experienced anything interesting lately? And they go, you know what, actually, I saw Michael Jackson walking down the street with some really cool threads and a cane. You go, that is something I didn't want to miss. But that leads into the mnemonic, which is MJ Threads CA. I add that little story to it to try and suggest that there's something you don't want to miss, but also because the mnemonic itself doesn't sound very intuitive. What it stands for is M, myocardial infarction. So always important to ask people, have you ever had any heart attacks or any problems with your heart in the past? J stands for jaundice. So you need to ask them, have they ever had any yellowing of their skin or had any liver problems in the past? T is for tuberculosis. It's not something that a lot of Australians will have if they're born here. However, in Australia, we do have a lot of immigrants or people that have immigrated or emigrated from their home country to Australia. And we're also very close to Papua New Guinea, which has a high rate of tuberculosis. This is something that is really important to ask, not just do you have this, but also were you born in Australia? Where were you born? Have you had any recent travel? Hypertension is the next one. The reason it's really important to ask about this is because if you ask a patient, do you have medical conditions? A lot of them won't think of high blood pressure as a medical condition that they need to mention to you. It's just part of their life, something that maybe the GP mentions from time to time. The next letter is R. R is for rheumatic fever. You need to ask patients, have you ever had rheumatic fever? This is, I think, particularly important in Australia with our Aboriginal population that are at a much higher risk of this condition. The next letter E is for epilepsy. A is for asthma, another condition people might not think to mention, as well as something that maybe they've grown out of, but still something you want to ask. A really useful way of asking about this is, do you have an inhaler that you take sometimes? Because they might not think of themselves as having asthma so much as having a bit of breathing problems sometimes. D is for diabetes. This is another pretty common one in Australia, but also one that patients might not think to mention to you, because they might think, hey, my blood sugar is under control, my insulin is working really well, and so it doesn't come to their mind. But obviously diabetes impacts a lot of your medical care and is also a risk factor for a lot of other conditions. S is for stroke, so ask patients if they've ever had a stroke. Not only that, but have they had a transient ischemic attack? So a moment where they had a funny turn is how a lot of them might think of this. Finally, CA is for cancer. Ask them if they've ever had any cancers, whether or not it was removed, and if they've had cancers, are they still having treatment for it? What is their treatment? Get an idea of that regime. Now, when you're going through past medical history, I think a really good idea is to stop at every condition that they have and ask them about the medications that they have then and there. However, medications, when you're writing up a history, is its own section after that. I find if you do it the latter way, it can be a bit confusing maybe when you're starting off what medications are for what, but also when you're presenting it back to a physician, it's a lot more useful to them if you can say what the medications are for as you're going, rather than just rattling off a list of medicines. Okay, we've done past medical history now, well done. The next section, family history. I don't have too much to say on this because it's very much based on whatever the presenting complaint was. So certain conditions run in families, a lot of them don't, but depending on what that is will affect the questions that you ask in this section. Social history is a section that has a lot of variability, but I think it's a section that has a lot of very important information as well. So in this section, you want to ask things about their alcohol intake, their smoking, and also their illicit drug use. Another thing that I put in here is allergies. However, I feel like that's quite out of place, so definitely feel free to move that up to your past medical history or wherever you want to put it that is very memorable, but it's super important not to miss this one. Every time you present a history, if you forget the allergies, the doctor will ask you. The other thing that you want to include in this section all the time, I think, is information on their career, what do they do for a living, as well as information about their home situation. The amount of depth you go into here is going to depend again on the presenting complaint. A lot of the time it might not be very important, it might be more important when you're discharging them. That's not a problem for you as a medical student necessarily, you won't be thinking about discharges for a little while, but it is something that you want to get in the habit of asking about. Okay, so if you are doing a history taking exercise, congratulations, you're done. Those are all the things you need to do for your history taking. However, if you're going to be presenting this history back to a doctor, or if you're going to be writing it up, you also need to add a few extra sections. These sections are a differential diagnosis, so you want to try and think of a few different things that could potentially cause what you're seeing in this patient. You also want to include a plan for the patient, and somewhere in there, if you're writing things up, you can add your impression of the patient. So this was a well person that's going to need XYZ. Sort of like a little summary, I think. For your differential diagnosis, it's usually important to make sure you don't include one thing. It might be incredibly obvious to you what this patient has, but it's a really bad habit to get into pigeonholing yourself into a single diagnosis. So to ensure that you don't do that and that you're always thinking broadly, there is another mnemonic that might help you out here. There are a couple that you can use. One is vitamin MDC, I think, and the one that I'm going to tell you about is invited MDC. They essentially stand for the same stuff, just a different order. I is for infection, so can you think of an infective cause that could cause some or all of the symptoms that you're getting from this patient? N is for neoplasia. Would a form of cancer explain what you're seeing? V is for vascular. Can you think of any blood-borne conditions, often some genetic conditions, coagulopathies, or bleeding into a certain area that could be causing what you're seeing? The next I is for immunological or autoimmune. This is a section that you can always put something in because you can put in lupus. It's never lupus until it is. The T is for trauma. The E is for endocrine. So can you think of any hormonal conditions that could be causing what you're seeing, whether that's thyroid, diabetes, could be something in the pituitary gland. The first D in invited MDC is for degenerative. M is for metabolic. So can you think of issues maybe that a lot of the time might be genetic, but they could also be iatrogenic, relating to enzymes, the way that things are absorbed, the way that things are metabolized, that could have caused issues presenting this way. Leads nicely into D, which is for drugs. So iatrogenic also means medication or treatment-based problems. So could it be a medication that they're taking or a supplement that they're taking that could be causing this? And finally, C. Although I mentioned in a number of these areas that congenital problems could be related, this C is specifically for congenital. So can you think of any other genetic or conditions that they were born with that could be causing the symptoms and signs that you are seeing? And that is the end of this video. So I hope that some of those are useful for you. Like I mentioned in the start, if you have mnemonics that you find particularly helpful, or if you come across any while you're in med school that you think other people might find helpful, then please absolutely mention them in the comments here. I'm going to leave it here. So all the best with your med school studies, getting in, and life in general. I'll see you next time.